I'm Dr. Jessie Callahan, a fellowship-trained addiction and adolescent medicine physician with particular interest in how substances affect families and communities. In the last few years, there's been a lot of media focus on the devastating impacts of the opioid crisis, the dangers of youth vaping, and the dramatic increase in alcohol-related deaths during the COVID-19 pandemic. For some parents, this really doesn't seem relevant to their teens, who are just kids who may be experimenting with substances that'll never become an issue for them. Other parents really worry. They may have a family history of addiction, their kid may be struggling with mental health or behavioral concerns, or may have heard really scary stories from their friends. The reality, of course, is both. The good news is that substance non-use amongst adolescents is higher than it has been since 1975, so that when high school kids graduate, over 30% of them report having never tried a substance, including alcohol, marijuana, or nicotine. In 1975, only 2% of high school seniors said they had never tried a substance. The bad news is that the market has exploded in terms of various devices or ways that young people can access and use substances. There's vapes, which are subtle devices that are marketed for teens. They come in, fun flavors, fun colors, and they allow young people to use nicotine and marijuana in settings where it's really problematic. During school, in the bathroom, before sports practices, potentially even while driving. The legalization of marijuana in many states has also had an unintended consequence of decreasing perceived risk of marijuana amongst youth. So as marijuana has been legalized, recreational marijuana, in various states, reports, national surveys that we have of young people show us that young people are not as worried about the risks of marijuana use. Instead, they perceive it as safe, as healthy, as natural. More concerningly, overdose deaths amongst adolescents, primarily due to fentanyl, have increased dramatically since 2019. And now drug-related ingestions and overdoses are the third leading cause of death amongst children and adolescents in the United States. According to data published in December of 2022 by the Centers for Disease Control and Prevention, overdose deaths amongst 10 to 19-year-olds increased 109% from 2019 to 2021, and overdose-related deaths due to illicit fentanyls increased 182%. Most of the youth who died had no known history of opioid use, meaning either that this was the first time that they have ever tried an opioid, or that no one had ever asked, or that they had never told anybody about their youth. The majority died at home with a potential bystander present, meaning that they may have been in their bathroom or their bedroom using an opioid while mom was cooking dinner or doing something else and had no idea what was going on. And maybe most concerningly, only about a third of them received naloxone, which is the opioid overdose antidote or reversal agent that we know can save lives. This was a major wake-up call to those of us in the adolescent substance use world, because it showed a couple of things. One, we're not properly identifying young people who are at risk for opioid-related consequences, in this case, fatal overdoses. We're also not engaging these young people in care, maybe because we're not accessing them, maybe because we don't have appropriate resources for them for treatment. It also identified that we're not effectively reaching families. So we're not teaching families how to recognize signs of substance use, particularly opioids. We're not teaching families how to engage young people in care or in their concerns around their use. And we're not teaching families how to address overdoses. So I think for a lot of us, this really emphasized how much work we have to do, both in the education and in the treatment spheres.
Bloom is a collective of brilliant doctors, inspired educators, empowering social influencers, and leading organizations sharing their expertise, knowledge, and shared mission to help us feel more connected and live a healthier, safer, and more fulfilled life, a life we all deserve. Together, we are co-creating an inclusive space where all are accepted, celebrated, and empowered to be their authentic selves. Together, we create meaningful change. Together, we bloom.